Hello and welcome to the Happy Healthcare Professionals live show. It's Komal, it's the Happy Healthcare Professionals live show, and it's happening at 1 o'clock in the afternoon, which is pretty exciting actually, because I have to say I haven't done this live show in the afternoon for ages. I had to remind myself several times that it was happening at 1 o'clock in the afternoon, but I'm really excited to be here today. If you don't know who I am, my name is Komal. I'm a former national level pharmacist turned career coach and business strategist to pharmacy professionals. I really love helping pharmacy professionals to create careers that they absolutely love, and also now create clinics as well in specialisms that they are really, really passionate about. So today's live show, I wanted to touch on the theme of this month's International Women's Day, and that was about breaking biases. Now, last week I hosted a session with the Female Pharmacy Leaders Network, and we talked about breaking biases. And it was a fantastic session, which is the reason why there wasn't a live show last week. But I wanted to continue this conversation. And I have been wanting to have this lady come on this show for a while, because what she has to say and her experiences, I am sure that many of you will be able to relate to. So I am really, really excited that Preeti Minhas is joining us today. She is the Education and Training Director at Education for Health. And I am so, so excited that she's here. I'm going to bring her on screen now. Hi, Preeti.
Hi, Komal.
How are you?
I'm good. Thank you for having me.
I'm very excited to have you on. I mean, look, we've obviously connected several times. And when I reached out to you, I was like, now is the time that Preeti needs to come on this show and for us to have this conversation. So, we're talking about breaking the biases with education and training today. I'd love for you to tell me a little bit about your background and your history as a pharmacist.
Yeah, so so as you know, I'm Preeti Minhas. So I got, as everybody, I did my pharmacy degree, did my pre-registration year, and I really thought I'd start off on the route of becoming, going down the management route, so being a manager, pharmacy manager, area manager, regional manager, and so forth and so on. Clearly that did not work out. Actually it was through that journey. So I was a community pharmacy, managed many pharmacies, so from small to large. And then I then moved to the Midlands, and upon moving to the Midlands, I had an opportunity to go and work in a learning and development team for a pharmacy organisation. And I guess that's probably where my journey started. I remember being at a pre-reg conference and thinking, do you know what, I would love to facilitate workshops, etc. one day. Did I ever think it'd bring me down into the career pathway that's now that I've gone on? No, actually. And yeah, so I think the opportunity came up, so I grabbed it, and I guess that's where my journey started. So I then moved on to do another learning and development role in a different organisation. And then an opportunity came up at the organisation that I'm currently at, and I'd learned a lot about pharmacy, how to develop the workforce in pharmacy, but actually I wanted to take a step back. I wanted to see the NHS from a different lens, and also wanted to understand, the kind of primary care functions and working and secondary care, and actually how the workforce is shaped to develop that. So I'm currently at Education for Health, where I'm the Assistant Director of Clinical Learning. So my remit is to look after all the clinical learning of our courses. So we deliver 2 sets of courses. So that's higher education courses, which are at a master's degree diploma level. And then you have our CPD accredited workshops. So they're very much bite-sized learning that healthcare professionals can pick up and participate in, and then further their career. And so with that, obviously, my role is very much to support healthcare professionals develop their knowledge and know-how around long-term conditions and other public health issues, such as COVID-19 is probably the right thing to say. Yeah. And then with that as well, we sit on a number of steering groups to shape clinical pathways or shape policies, because we are seen as that independent body. And also, it's developing strategic partnerships to again help healthcare professionals on the front line. So that's in a nutshell a little bit about my journey.
It's very exciting. Your journey has been really, really interesting, actually, because to go from that, to know from quite an early stage in your career that you wanted to go down the education and training path. It's quite rare for most of us, because we kind of go through this kind of like trying out different things and then figuring it out along the way. But it's really nice to hear that you actually worked that out quite fairly early on, actually, in your career, right?
Yeah, I think I knew there was some parts of it. I didn't know if I wanted a full-on career in it. I wanted to know a little bit more about it. I think, the best advice somebody gave me was always look at the opportunity. So always grab opportunities. And so that's exactly what I did. I asked somebody, what does it take to get me into the L&D team, or what do I need to demonstrate, or what do I need to do? And then an opportunity came up. So for me, it's about, I love being strategic, bit of commerciality and, workforce development. So putting all three things together, you get the role that I'm in today, which is perfect.
Amazing. Hinesh has just said, Preeti Minhas, you've done really well, especially whilst having children, as a strong woman in our sector. Good on you.
Thank you, Hinesh.
That's such a nice thing to say, Hinesh. It actually brings me on to the point that the next question that I was going to ask you, because I wanted to ask you about challenges, because, what challenges have you, experienced in your career, and how have you kind of overcome those?
Yeah, so I think there's, I think Hinesh's comment has probably lended itself quite well, isn't it?
Yeah.
So, there's always challenges in your career, and, it's about having the ability to bounce back. Not everything's going to work out. The job that you go for, you might not get it. So actually, how do you get back on track, and how do you take your time to be that resilient individual? So, I remember the first job I ever had was in I went in to go manage a large scale pharmacy, and that had care homes in. It had a busy over the counter, and it's a busy dispensary. And the tea, it's quite a negative environment at first, because they'd had quite a lot of change. Their staff retention wasn't the greatest. It wasn't operationally efficient. People didn't really have a work-life balance. And so, I remember going in there, and and somebody said, "Oh, Preeti, you've just got out of uni. What are you going to do here? Because there's a lot of pharmacists that couldn't do anything. And really, are you going to come in and do what you can?" And all they saw was not who I was or what I could deliver. What they saw was my age.
Yeah.
And so, it took me a lot of time. I remember going home and putting my my face in my hands, going, what challenge have I accepted? But, I always knew, I guess, who I was, why I was doing it, and what I wanted to achieve. And for me, it was about creating a team that, we spend a lot of time at work. So I wanted them to come and enjoy it. It's having that work-life balance. I wanted them come in not feeling stressed. I wanted them to, I know we almost don't look forward to work, but almost enjoying the time that they were there with me. And so I remember one of them coming back to me and saying, "But why are you doing this?" And I said, "Well, I described all of those reasons." And she said, "You know what? You're the first person that's ever stayed, because everyone else just left. And nobody's ever put us first." And I think when you start to explain the why to people, we're really good at explaining the what and the how. But when we start to engage, people and saying why we're doing something, I think it creates a different type of engagement. And that performance of that team went up quite quickly. And, we moved a pharmacy into an all Woolworths store that we managed to get. And they just did extremely well. We went from being the bottom to one of the top performing pharmacies, and also because that team delivered and we all engaged with one another, and it was a team approach. So that whole episode taught me a lot. It probably stands where, if I'd said to that individual who said something about my age, if I'd start to have a conversation with her, she probably wouldn't get it, because for whatever reason, her opinion of age is the way she's got it, right?
Yeah.
And I thought to myself, do you know what? Actions speak louder than words. There's no point me standing here and defending what you know, helping you to understand this, because actually there are some people that you want to put that effort in who know are going to understand you, or you just keep silent and then actually the actions will follow. And that's exactly what I did in that example, you know, and that's probably something I've lived with through my career. So I think that was probably one of the things that absolutely shaped my career and who I am today. And then I guess going back to Hinesh's comment is, you know, I get asked this question all the time, that how do I do what I do with 2 children? And I think I've been really fortunate to have some really great line managers who have given me the flexibility that I needed to be the best that I could be at work. And certainly in the current role, I have that. You know, I'm able to manage being a mum. I'm able to manage being an employee. You know, and I have many different roles, but that's no different to anybody else. So, you know, I remember the first time I was pregnant and I went to a networking event and somebody said to me, "Oh, so you're pregnant, so we're not going to see you anymore." And I went, "What do you mean?" And they said, "Well, you're probably not going to want a career when you come back, are you?" And I looked at them and I was so phased that this stereotypical, that just because I've gone to have a baby, I'm never going to return again. And, you know, this wasn't, like I said, it was just a networking event, right? A social event. But the amount of times you get that comment back,
Yeah.
you soon realize that bias is still there.
Yeah, 100%. I mean, I totally relate to that, because to an extent, I kind of had it in the other way around. When I fell pregnant, people were kind of like, "When is she coming back?" You know, and before I'd even gone on my maternity leave, I was asked questions like,
Yes.
"When do you expect to come back?" And I just sort of went, "I don't know. I've never been a mum before. I've got no idea what's going to happen after I've had this child. But one thing I do know is that I care about my career and I care about what I do. And whatever that's going to look like, it will come back in some way, shape, or form. You know, I will come back in some way, shape, or form.
Yeah,
But
and
I
that was,
can't tell you what that's going to look like."
yeah, and you know, I got the same. So like, it was 2 extremes, isn't it? You get some people saying, "Well, you're kind of not going to have a career now," and you get other people saying, "When are you going to come back?" And it's almost, there needs to be somewhere a happy balance, and we need to treat people as individuals, because today somebody might be a mum, somebody else might be a carer, somebody might be a pet owner. It's just a different role and responsibility. But we've got to let people, you know, there's a fine line between making decisions on behalf of people and maintaining their well-being. And I think, you know, I have a team of clinical associates, and they're very clear. As long as they hit their deadlines, how they need to shape their work around their other commitments is up to them, because we're able to do that with the nature of work we have. You know, I'm not going to say you need to work at 2:00 on this project. You do it when you can, but you've got to hit the deadline.
Yeah.
And I think, you know, we can't take that decision for somebody. If somebody's got several different roles, whatever they might be, it's up to that person to decide on how they're going to get it done and when they're going to get it done.
Yeah, I think that's such an important point, because I think it's very much conditioned into us that we have to work the 9 to 5, you know, that we have to do those hours. And one thing that I've realized is I'm personally not productive in the afternoon. That's not my productive time.
Yeah.
But I'm productive in the morning. And so if I spend the time being productive in the morning, then isn't that better for everyone? You know, you hear stories of companies that have trialed 4-day working week, right? And the productivity shot up.
Yeah.
Because, you know, people are getting that balance that they need. And the point you made earlier about we have to individualize this is really important, because what comes to mind is, you know, we are all patients first before we're healthcare professionals, aren't we? Every single one of us is a patient first. So, we have to think about it from that perspective that, look at your own self as a patient and say, what's right for me, as an individual, right?
Yeah, absolutely. And I think it's maintaining that balance, isn't it? If you've got a service that, demands that you need, you absolutely need to look at what you need and what workforce you need to deliver it. But it's almost, we spoke about this a lot of times, haven't we, around it's about being creative, it's about thinking outside of the box, and I think, like I've always said, certainly, for the past couple of weeks, certainly, we're dealing with a different type of workforce today in health. We're dealing with an exhausted workforce. We're dealing with a demotivated workforce. We're dealing with a workforce that have been through quite a lot for the last 2 years. So actually, the way we start to engage with them is going to have to change. It's going to have to be different now.
Yeah.
And therefore, it's about balancing that kind of work-life balance that you have, and that does take time. It is going to take energy. You absolutely need to look at your costs as an organization. But it's how do you start to balance all of that in light with how the world is now changed, because the world has changed.
Yeah. Yeah, it really has. And, you talking about the biases that still exist within our profession with regards to us as in terms of our age, in terms of us being women, maybe women of color, maybe, not a woman of color, all sorts of biases that exist within our profession, but generally in society as well, right? They exist. But at the same time, we have to recognize your point of we are now in this place where everyone is tired. Like every single person is tired and exhausted, and it feels relentless. And, there has to be, even patients' behavior has changed over this time.
Yes.
Right. And so we almost have to dial up the compassion even more, don't we? Because as much as we hear the stories of patients being really abusive in pharmacies and healthcare settings, we have to be compassionate because it's tough on them too.
Yeah.
Right? Yes, it's tough on us, but it's also tough on them too. And now I know it sounds doom and gloom, but with the cost of living crisis that we're facing, that's going to be even more heightened, right?
Yeah, absolutely. And I think that is, when we talk about biases, I always say this with the women, this isn't men versus women. This is about people versus prejudice. And so every time I've had that, I go back to what I said at the start, is actions speak louder than words. I'm not going to stand in here and defend my view, but actually I'm going to give you a different perspective on things. And that for me is a way of kind of getting through people. They're entitled to their opinions, but actually it's how do I give you a different perspective to consider. And going back to what you're saying is we need to look after ourselves. That's, yeah, absolutely. We're not going to be good to anybody if we don't look after ourselves in the first instance, our well-being. So when you're a healthcare professional, that's even more when you're dealing with the health of the nation.
Yeah, absolutely. So how do we change things, Preeti? How do we change things going forward through education and development? How do we do that?
So I think COVID presented a lot of challenges, which we all know in the health sector. But I think if we look at our profession, I think it's going to give us a lot of opportunities. And certainly in my role now, having worked with nurses and doctors and consultants in some steering groups, it's really given me a different perspective of how as a profession we now need to start to engage. So, there's lots of opportunities where I sit on a group and we're dealing with increased backlog of respiratory patients. And I'm like, your community pharmacist can do that. But when I look around, I'm the only pharmacist in the room. We've got such a great opportunity to play with reducing the carbon footprint, of medications being prescribed.
Yeah.
Again, we're experts in that. We need to shape policy around it.
Yeah.
We need to shape career pathways around it. And I think, one that's really close to me is health inequalities. So, again, we're brilliant at reaching out to people. We're brilliant at engaging with our local community. So we need to be at the forefront of supporting that agenda. And that agenda will change locally because our population needs are very different. But
Yeah.
again, that's a real opportunity for us as a profession to really get behind and really make a difference. And I think education and training is really, really important in that, because it's like what I just said, is we're not dealing with pre-pandemic. We can't go back to the way we were as a workforce pre-pandemic. We've now got these opportunities that have come. So actually, first of all, we need to have the clinical expertise to do that. So we've got to get ourselves refreshed knowledge, enhanced knowledge, but we also need to be able to lead. And I think, there's a misconception when we say leadership. It's not about you being a manager. It's about you taking things forward as a registrant or as a healthcare professional. And I think for me, that's where education and training, we've got to start building this workforce up that is able to lead, is able to start to engage with other healthcare professionals in a very different way, to say, we can be supportive. We can be seen as that multidisciplinary team approach. So, a couple of weeks ago, I was in a session, in a workshop, and I was with a group of I think it was about 35 nurses. And I said, so guys, how are you going to do we've talked a lot about stuff about enhancing asthma care, but how are you really going to do this in 10 minutes? And they went, Preeti, that's exactly what we were thinking. And I said, who have you got around you that can help? And they all said, well, I've got a GP, but he's really busy or she's really busy. Don't really have anybody else. And I went, really? Really don't have anybody else? And they went, no. I went, well, what about, the community pharmacist down the road? Or what about your practice PCN pharmacist? And they all looked at me going, I didn't think of that.
Yeah.
Oh, I could get them to do this, or I could help them to get. So it's about starting to engage them in actually what we as a profession can do for them. And,
Definitely.
one person isn't going to be able to do this. We all need to do this in each of our geographical areas, but have the confidence to have those conversations and believe in ourselves. I think that is key. A lot of the
Belief
time.
in ourselves is just one of the things that I come across time after time when I speak to pharmacists. Our lack of belief in ourselves, right?
Yeah. And we're there as a profession for a reason. And I think, you're not looking for other people's validation. Your own validation is enough for you. So actually, as a profession, that's something we need to believe in. We need to believe that we do add the real expertise. And I think COVID-19 with the whole vaccination program, it was brilliant, because I think the general public started to understand our role and what we can do. But we've got to carry on that journey now. It's not about stopping it today. It's about keep on going, educate people. My own family, they probably didn't even understand what a pharmacist did until I told them. I'd be like, my dad, you need to go to your pharmacist to go and talk about your medication. No, I need to go to the GP. No, Dad, you need to go to the pharmacist. And it's, again, you've got to keep going on. One way of saying it isn't going to work. You've got to try several different ways, but you've got to keep on repeating that message.
Yeah, you've got to sound like a broken record.
Maybe engaging in different ways is probably how I like to say it. One way isn't going to get it. It's like when you talk to kids,
You're right.
One way doesn't work. But actually, I think I was teaching my 5-year-old with his handwriting, and I kept saying the same thing to him, and he just wasn't getting it. And I realized that I need to say it in a different way, like do a figure of 8. And he's like, oh, Mum, why didn't you just say that in the first place?
Yeah. It's that parenting rule of show and not tell, isn't it?
Yeah.
Going back to what you were saying earlier about actions speak louder than words. We've got to show what we can do, and that's how people will start to notice as well. And as you say, going back to that point, really important point of describing it in different ways, showing what you can do in different ways. I really love this. I want to go through this comment that's come through. Apologies because I don't know who this person is on Facebook, but individualizing is really interesting point, because I would like leaders to look at what skills are required for a post rather than looking at which qualifications someone needs. I found this really difficult being a pharmacy technician, where it's difficult to progress because roles within pharmacy are pharmacy specific, even without the clinical need. Lots of intersectionality issues for us in the profession. So true, right? That, I think what we've realized is that our skills can be used in lots of different places and in lots of different ways. And the challenge for us is we like things to be really nicely packaged. Like we want them to be like really nicely, packaged out, and we know exactly what we fit into. But actually, the world doesn't look like that anymore. And so we can't, we've got to stop. We've got to stop putting these barriers on. Going back to what you were saying earlier about, before we got on the call, that you were looking at these job adverts, and there was a job advert for a community pharmacist role, but it was full time, and nothing in the advert said we would even consider a job share on this role.
Yeah, absolutely. And I think that's where we, when I said about being creative and thinking outside of the box, yes, that's repurposing your own resource in your own organization to handle those, job share. But if we don't talk about that, how is an individual going to know that that may be an option on the table? Because effectively you could make up that workforce, that full-time role. And it's really interesting because in a recent study, I think it's released a couple of days ago from the Institute of Physical Studies, they looked at nurses and doctors returning after maternity care. And what they found is that there was a large variation in the number of hours people did. And the report did suggest that that may be down to individual preference. But what they found was actually there's a huge variation in a trust policy around bringing people back.
Right.
And when we're talking about that, there's a 50,000, gap in nurses, for instance, could we bring that population to gap, to cover that 50,000, or even halfway through, or at least a third of it, or whatever you want to call it. So it's thinking outside. That job share, was one we talked about. There's nothing on that advert when you just have a look to say, could you job share with another individual? And how motivated would the individual be when they can, let's just talk the example of kids where they can, okay, for 2 days they can't pick up the kids from school, but actually for 3 days they can.
Yeah.
And it's about looking at things in a very different way.
Yeah. And, going back to the technician point, could it be a pharmacist and a technician that share that role?
Yeah.
Is that, and I think one thing that I've learned is we are, as individuals, we're interested in many different things. We have many different skills. And one of the areas that I think is going to actually continue to grow is this concept of doing portfolio work, because we like doing different bits of work and that interest us. And this is where, when you open up the possibility for somebody to work, in a shared capacity, you allow them the chance to do other pieces of work that interest them as well. And that only makes for a much, much better workforce, doesn't it?
Yeah, absolutely. And I think, again, there was a report from the King's Fund around PCN pharmacists recently about being lonely. Yeah. And I think somebody's recommendation was, well, why can't they go and work in the community pharmacy? So, it is thinking, we would never have thought pre-pandemic to even think about things like this, that working from home was a no-go for a lot of organizations, and everybody's suddenly doing hybrid working. So again, it's breaking that mold.
Yeah.
Because, portfolio careers are brilliant. If you go back to the person that's coming into your pharmacy, it's more than likely they have comorbidities. You're not dealing with one condition. So again, within, your community pharmacist, do you have people that can specialize in each of these therapeutic areas? And could you develop a service which could enhance the local population, of asthma?
Definitely.
So you're not having to do everything. But again, that portfolio approach is so important. And that's within any, I think, healthcare role.
Yeah, absolutely. Absolutely. So, gosh, we've talked a lot Preeti, about, you know, what we think, you know, what we think pharmacy should look like. And I think also just kind of some of the small ways in which these kind of barriers can be overcome, right? How do we do this through, you know, creating these interesting roles that are giving people the opportunity to job share, you know, putting the education and development behind it, leadership, you know, going back to your point about leadership, it is such an important point that, you know, for many, many years, I never, ever considered myself to be a leader in any way, shape or form. And we need to change the narrative around that, because we, like you said, people think you're only a leader when you become, you know, a supervisor or a manager or a, you know, a regional manager, etc. And that's just not the case. We are, you know, the way I like to see it, where I like to describe it, is we're already leaders when we come out of pharmacy school. People already look up to us.
And I think it's about, you know, taking those findings from different sectors as well.
Yeah.
You know, you look at, you know, different banking sectors, they don't ask anymore for a 2-1 degree anymore, or a first class degree for graduate programs. So going back to the qualification comment, you know, how do we start learning from other sectors? How do we start to take some of those findings and apply them? Because the world of health is, yes, it's unique, but there's also, you know, the same difficulties and challenges in other professions.
Yeah, 100%. 100%. Thank you so much, Preeti, for today's
Thank you for having me.
I've really, really enjoyed it. And Sarah's just said, I can completely relate to your experiences, Preeti. You are fab.
Thank you so much.
Thank you so much, Sarah. You know, it's really lovely having you on the show today. Really appreciate you spending the time with me. And I can't wait to continue this conversation at some stage, because I'm sure it's going to come up again.
Yeah, no, I think it will. And you know, I'm glad it's helped people, but it's just, you know, it's go and be creative, go and explore, go and find ways to break the mold.
Definitely. Definitely. Thank you so much, Preeti, for being on the show, and I will speak to you soon.
Thank you. See you later. Thank you, everybody.
That was Preeti. We had such an amazing conversation. Thank you so much for watching the show live. If you did join us, Sarah and Hinesh and anybody else who watched, I know there were a couple of Facebook people on here that I didn't get to know what your names are, but thank you so much for coming and watching the show. Do stay tuned, because Happy Healthcare Professionals live show is going to be back next week, and I'm going to be interviewing an internal coach for a community pharmacy. I've got Simon Harris, who's going to be joining me next week. It's going to be 1 o'clock again. So do join me then. Really looking forward to you joining me then, and have a great week, and I'll see you next week. Bye.